and welcome. This is Health and Wellbeing, and I am your host, Lois Apasambu. Humans have a very close relationship with animals, be it as pets or as food. And this invariably means that there is a significant exchange of microorganisms between animals and humans. And this could also extend to an exchange of diseases, which are called zoonotic diseases, such as the coronavirus, monkeypox, Ebola, and so many others. Scientists say a significant 75% of infectious diseases are gotten from animals in one way or the other. And therefore, the One Health approach has been initiated as an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. Today on the program, we shall be discussing zoonotic diseases and the One Health approach. And today, our guests are the program officer, Today on the program, our guests are Mrs. Omolara Oyinlola, who is the Risk Communication and Community Engagement Program Officer, and Dr. Adunola Oyegoke, who is also the Senior Program Officer for Risk Communication and Community Engagement at the USAID Breakthrough Action Nigeria. Thank you very much for joining us on the program today.
Thank you very much for having us.
Okay, now we're going to go on a very short break, and when we return, our discussion will commence. Please do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we will realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
Welcome back, and thank you for staying with us. If you're just joining us, you've not missed a lot, and the conversation is just about to start. Before we went on the break, I told you we will be discussing zoonotic diseases and the One Health approach. And when I say zoonotic diseases, from the word zoo, it should mean that we're talking about animals here. So, Dr. Adonola, before we went on the break, I said we're going to talk about One Health, the One Health approach, and zoonotic diseases, basically because we cannot talk about One Health without zoonotic diseases. But so that it doesn't sound so big and ambiguous, let's start with what is the One Health approach? Because when someone hears One Health, is like, what does that mean, you know? So tell us, what is the One Health approach?
Yes, thank you very much for that question. So the One Health approach is a unifying approach that brings together multiple sectors and disciplines. And when we're talking about sectors, we're talking about the agricultural sector, the health sector, the environment. So we can see that we are having an interplay of the human health, the animal health, and the environmental health within the One Health approach. So the One Health approach is no longer looking at health through the lens of the human health alone, but it's unifying the three sectors, bringing together various sectors, various disciplines to ensure that we have one approach for managing the health of people, the animals, and the environment.
Okay, so when we talk about, like you said, one approach, we're looking at it as one big bowl. Wouldn't there have to be a need where we still break it down? Because, okay, maybe human treatment is different from animal treatment, and then environmental health is also different. Wouldn't there be a need for that?
Yes, so what One Health does is that it brings everybody together. Even though everybody has their own area of specialty, the people in the human health, they are managing humans, the people in animals are managing animals, and those dealing with the environment, they are there. But with One Health, everybody comes together to one table to look at how each of these areas are cross-cutting, how they interplay or they intersect with each other. Because we know that in recent times, there has been a lot of interaction with animals, and what we do as humans, it affects animals, what the animals do affect us, and what we do also affect the environment. So One Health is that approach that helps to address all these areas and brings everybody together so that we'll have an holistic way of managing health.
Okay, so now talking about that, I'd like us to talk about the interdependence of animals, humans, and the environment. And just like Dr. Adunola said, I'd like you, Mrs. Omolara, to let's talk about how animals, humans, and the environment need each other and depend on one another.
Okay, all right, thank you very much. So, like you said, we all need each other to survive. And with the growing population, we've had people, move into the animal space more so that they can, make room for themselves. We've also had a lot of activities with animals. So animals are no longer serving as just food for humans. They also serve as, tourist attractions. They use them for global trades and all of that. And then we also have a lot of people moving, across different continents. So all of this just really tells us about how much we all depend on each other as animals, as humans, and even our environment. And when we understand the relationship that exists between us, then we can think of better ways to manage this relationship in such a way that everyone, is not, no one is affected at the end of it all.
Okay, so let's talking about how we would learn to manage this, because obviously that's the essence of One Health here. How do we manage this now? Animal health, human health, and environmental health.
Okay, so we know that there are health threats, that face us as individuals. The animals also have health threats that they are faced with. So it's very important that we understand this interplay and we take responsibility where we need to. Also, when it comes to our environment, a lot of our activities, nowadays, is causing a lot of harm in the environment, and we need to understand where we need to draw the lines and what we need to do to ensure that we are still safe and it's a safe place for the animals to live in. Another thing is, when it comes to the animals, they also have rights. So who is fighting for their rights? We talk about human rights, but how much are we, thinking about animal rights? The environment too. A lot of our activities have resulted in climate change. So how are we thinking of how these activities are contributing to some of the things that we're experiencing? Currently, we're battling with flooding in Nigeria. And we know that this is also being caused by human activities. So what are we doing to ensure that we put a stop to some of these activities or manage them in such a way that it doesn't pose health threats to us at the end of the day?
So this makes it look like we humans are the culprits here.
If you say so.
Because it seems like we're the one doing harm to animals or the one doing harm to the environment, and so everything now depends on us as humans. Dr. Adunola, I'd like us to talk about zoonotic diseases. And just like we said, zoonotic diseases from the word zoo means diseases from animals. Yes, well, I think that's the basics I can give. But as the specialist, I'd like you to tell us more about that.
Yes, so like you said, zoo, we're talking about animals when we say zoo. So zoonotic diseases are those diseases that spread from animals to humans. And like Omolara mentioned earlier, there has been a lot of interactions with animals over the years. We've stopped using them just as food, but we've also gone on to start developing relationships with animals. People keep them as pets. There are a lot of interactions going on with animals. So it makes it easy for diseases that affect those animals to spread to humans. And in recent times, we've been seeing diseases that we've not been seeing before that affect humans, which are gotten from animals. And a common example that we've been managing in Nigeria will be something like Lassa fever, which we know that is a result of infection from a virus called the Lassa virus that is spread from the multi-mammate rat. And we know that definitely before you have rats in your house, there has to be something about your environment that is bringing that in. So you can say that even that is showing some of the interplay we're talking about. So the human, maybe you're keeping your food or doing some activities in your environment that is bringing the rats into your homes, and they're spreading the diseases. So those diseases now that they bring in with them, they are the zoonotic diseases, and it can take various forms. Even something like COVID, it was suspected that it was something that was gotten also from animals, maybe from animals being used as food. Yeah. It started at the Wuhan seafood market. So we can see that these diseases, they are actually quite common, and they are as a result of our interactions with these animals.
Now you're beginning to touch one part that is very sensitive when you talk about food now. Because people that like, especially Yoruba people that like food with a lot of meat, it now makes it look like, okay, we'll have to be very extra careful about that. Does the One Health approach look at this aspect as well? I'd like Ms. Omlara to talk on that.
Okay, so I think what the One Health approach, focuses on is how can we live safely? And when it comes to food, what are some of the things that we need to do? Of course, we have to eat. We can't take that away. Yeah, but how then do we make sure that our food is safe and it doesn't cause harm to us at the end of the day? So we would advise people, to cook every form of meat properly so that even if there's anything in there, by the time you've cooked properly, it dies. Another thing that would encourage is handling. When you're handling some of this, particularly meat from rodents or bushmeat, as it's called, how do you handle them to ensure that you don't hurt yourself in the process, or even if you have a cut already, how do you ensure that nothing from the animal gets into your own body? So it's really around living safely or managing things safely. That's just the approach.
Okay, managing things safely. I think we can work with that. But there's seafood, something like sushi that is not. How do we handle those kind of foods? Something like sushi that's the fish is not. I don't even understand how that how that works. How do we work around those kind of foods?
So I think what we need to, if we understand that we will need to make sacrifices for us to stay healthy, then it gives us, better perspective as regards what we need to do next. So if we understand that if we don't eat sushi, we will still, survive. There are other things we can feast on that will not necessarily cause us harm, and we could take it from there.
And so that's talking about making sacrifices, and just like I said, as humans, we end up being the culprit because everything now is tied to us, tied to human activities. And just like Dr. Adenola spoke about climate change, it's all about human activities and what we do. So I'd like us to talk about how we as individuals also impact animals. So I know most times it's mostly animals giving us diseases. Is there a situation where humans also transfer diseases to animals?
Yes, so like you said, it's not a one-way thing, it's a two-way thing. So even though the animals can give us disease, I believe that we can also give the diseases back to the animals. So it's possible humans can also spread diseases to animals, especially when we look at all the activities that we as humans that we do, keeping them as pets. We know that in recent times there have been reports of some dogs that tested positive for COVID. Probably their owners had the COVID, and based on the interaction, they were able to spread this. So of course, this is very possible. But the good thing is what One Health does is that before, the focus has been mainly on human health. and how to just keep humans healthy. But now with One Health, we're able to look beyond just keeping the humans healthy, but also considering the animals and as well as the environment, so that, because if the animals are unhealthy, they'll still spread the disease back to the humans. If the environment is unhealthy, so it goes around like that. So, but when we pay attention to each of these critical areas, we're able to protect everyone at the end of the day.
Okay, so I'd like us to, I wouldn't say digress a little, but we're still going to talk about one of such zoonotic diseases, and that's rabies. And the reason why I'm picking rabies particularly is because most people, quite a large number of people, have dogs as pets, you know, and I've heard a lot of myths. If a mad dog bites you, if a dog that has not been vaccinated against rabies bites you, you would go mad and all of that. So I'd just like us to dwell a little bit on that, because I know it affects quite a number of people. Talking about rabies, what can individuals do to, especially for rabies, stem the transfer, or do I say infection of rabies from dogs to animals?
Okay, so for rabies, I think the most important thing is to ensure that the dogs are vaccinated against rabies. And if this is done, at least if somebody suffers a dog bite, they can be rest assured that, oh, they are protected in a way because the dog has been vaccinated. So ensuring that people are aware on the importance of vaccinating the dogs against rabies, I think that would be the most important step to take.
Okay, so let me just ask this question. This question is for me. If my dog bites somebody, will the person get mad?
Okay, so I think if the first thing to do when somebody has had a dog bite would be to do some form of first aid, which will include washing the site and then going to a health center to ensure that you get the rabies shot, so that you will know that you're protected from it. And then, of course, the dog would have to be kept under observations to know. But how will you even know that it's a mad dog, really? What if you provoked the dog and that's what upset the dog to bite you? So you will never know. So like I said, vaccination will still be the most important thing to do in that situation, and then finding out about the history of the dog's vaccination history. If it's a dog that you know the owner. Yeah.
Okay, I'd like us to go on a very short break. When we return, we'll continue with our conversation on One Health and zoonotic diseases. Please do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
Welcome back, and thank you for staying with us. If you're just joining us, this is halfway through the program, but we'll find a way to put you in. Before we went on the break, we've been discussing zoonotic diseases and the One Health approach, and this is especially because we all have a very close relationship with animals and the environment, so we always have to find a way to intermarry these three: human health, animal health, and environmental health. So I'd like us to talk about One Health Day. So today is One Health Day, and I'd like you to talk more on the theme of, or the theme for the One Health Day for the year 2022. I'll start with Dr. Adunola.
Yes, so the One Health Day is a day that is internationally celebrated to talk about One Health, to highlight One Health, the One Health approach. And for this year, the One Health Day would be connecting animal, human, and environmental health. So it will be a good opportunity for us to let people be aware of what One Health is, and so that people can understand what role they play in keeping the environment, the animal, and the human safe.
Okay, so I'd like us to talk about the activities. I'd like Mrs. Omlar to talk on that. The activities surrounding the One Health Day. So I know it's not just for a one-day thing, but it's just to commemorate what One Health should be. What are the activities that are surrounding this One Health Day to most especially speak more to people and enlighten more people about One Health?
Yes, so one of the things we're doing is, this program that we're currently running, which helps us to create awareness about One Health approach. We also have, community activities going on in some states where we are engaging with communities for them to have an understanding of what the One Health approach is. At national levels, to different MDAs are coming together to see how they can review their activities and see where they are in terms of implementation, what they need to do or take forward in order to continue to improve the One Health approach.
Okay, so talking about implementation, is there like national policy right now for One Health, or is that still in the pipeline or something?
So we have a One Health strategic plan for the country, which is operational actually. And that's what guides the activities at national, state, and local government levels.
And I'd like us to talk on common One Health challenges that we have in Nigeria, because the essence of this is so that we're able to see it in the light of things that affect us and better ways in which we could help our health as well. So from Mrs. Omolara, I'd like us to take it from what are the common One Health issues that we have in Nigeria as a country?
All right. Okay. So most of the things that we have, as a result of, this interdependence that we talk about are the spread of infectious diseases. And we've had quite a number of them in the last couple of years. We've had Ebola, we've had monkeypox, we've had coronavirus. Currently, Lassa fever. Also, cholera is also something that, is being looked at through the lens of One Health, because when there's flooding in the environment, the water washes, quite a number of organisms into water sources that we take, especially in areas where they do not have good supplies of water. And this can cause, infections to them, particularly cholera. So we have quite a number of them in Nigeria, and it's important that we really just take responsibility as human beings. In this situation, we're the bigger ones, so we need to play the big brother role and take responsibility for the environment and the animals that live in them.
So when we talk about cholera, cholera tilts more to health, environmental health. And then Lassa fever, like Dr. Adinola has spoken, more like animals too. Lassa fever has actually been a major problem for us in Nigeria, and of recent we've had reports of a few cases as well. Quite a number of people don't understand how this Lassa fever thing is. We just know that, okay, it's from, I think, from rats or something. But I'd like Dr. Adinola to explain more on that for us. How is Lassa fever transmitted from animals to humans?
Yes, so for Lassa fever, like I mentioned earlier, it's caused by a virus that is usually found in the multi-mammate rats. And when I say multi-mammate rat,
Because I was about to ask,
it's
is
a
that the
rat.
normal rat that we know, or
Okay,
the normal one in
so-
our house, or there is a
so-
special kind of rat?
So the multi-mammate rat is this rat that when you look at it, it has like several mammary glands, that several breasts across the surface. So I'm not saying people should go and start picking up rats to confirm whether it's multi-mammate or not, but that's just basically what the multi-mammate means. And these multi-mammate rats, they can get into the household, and when they get into the household, they can contaminate food with their urine, or when they pass excreta that gets into food. And of course, this can only happen when the food is not properly covered or when they have access to the food. So, and for Lassa fever, that's just one of the ways. Lassa fever can also be spread from humans to humans. So apart from people getting it from the rats directly, people that have been infected can also spread it to other people when healthy people come in contact with infected body fluids of people that have the Lassa fever.
Okay.
So that's how the Lassa fever is spread. Basically.
So, what are the signs and symptoms of Lassa fever? How would someone know that or think that I may be down with Lassa fever?
Okay, so Lassa fever presents with quite a number of symptoms, but one thing people need to look out for is once you start treating fever for more than 2 weeks, and you say that this fever is not going, maybe you're having fever and you think, oh, it could be malaria, you treated malaria, of which you're not supposed to even do self-medication for malaria. You're meant to test to
Yes.
confirm whether you have malaria or not. But once you're treating fever for more than 2 weeks, it's always good to go and get tested, because that could be one of the signs. Then other signs could be if the person is having headache, if they're having lethargy, like body pain, feeling general body weakness. But the key thing for Lassa fever is to present early. So that's why once you're having fever, fever can be a symptom for so many diseases,
Yes.
not just even COVID, it can present yellow fever. So once you're having fever, don't just think it might be malaria and self-medicate. It's always good to go and get tested so that you'll be sure. And of course, when the health worker takes the medical history, they'll be able to direct you on the appropriate test to take to know what exactly is wrong.
Okay.
Yeah.
So I'd like us to talk about how these issues are being tackled, since we're still on Lassa fever. So Omolara, I'd like you to talk about that. How is Lassa fever being tackled in Nigeria, and knowing that it's something that is very common with us, so it comes and goes. We see pockets and pockets of these diseases in different places. But as a country and using the One Health approach, how is this being tackled?
All right. So with support, from USAID and, with NCDC leading, we are able to build the capacity of community people to actually identify the signs and symptoms like Dr. Adon talked about. So when people know what the signs and symptoms are, when they see it, they can, readily go to the hospital to report these cases. Particularly in Bauchi, where we're implementing, one of the things that we've been able to see is that as against suspected cases, we've had more confirmed cases because people were able to report early. So before now, what you would hear is a suspected case, because by the time the person presents late, they're not sure what exactly is wrong with the person or whatnot. But now we're able to have more confirmed cases, and this is because people now know what the signs and symptoms are, and they understand that when they see these things, then they need to, go to the health facility to get further to get it further investigated. So, one of the key things that we're doing at Breakthrough actually is building the capacity of our community members to really understand the signs and symptoms, and then when they understand it, also understand the benefit of early care seeking or prompt care seeking. For Lassa fever, the key for most diseases actually, early detection would go a long way in determining how the disease progresses. So when you identify what the cause is early, then you can intervene and save the life of that person.
Okay. So I think we're good with Lassa fever. And then you started talking about cholera earlier, and cholera seems to be like a very rapid killer. It kills within the shortest possible time. What are the signs and what are the symptoms that one would see in him or herself that would make the person think, I think I am down with cholera?
So Excuse me. So for cholera, you would experience stooling, very loose stool, and because you are passing out stool frequently, you're losing a lot of electrolytes. And that's one of the reasons why it kills very fast, because you're losing a lot of body fluid. So when you notice that you're passing stool frequently, it's important that you just go to the hospital, to get some kind of help.
Okay, so just stooling, and because I think I remember someone talking about also throwing up or something.
Yeah, so it could come with that, but the first thing is, that very loose stool.
Yeah, I think this gives it more perspective because, like I said, I've heard people say when you're stooling and vomiting at the same time, then it should be. I think maybe that's like an extreme form.
That's probably maybe the advanced stage, but again, once you notice that your stool passage it's very loose and it's very frequent, you know what your body system does on a normal day. So you would know when there's a difference, when something is not right. So it's important to just go to the hospital.
Okay. So I'd like us to talk about what we can do as individuals. Because when we talk about the One Health approach, when you say multi-sectoral, it looks like one sector, the health sector, the animal health sector, the environmental health sector. And yes, they all have their their roles to play in this. But for us as individuals, what is our role in the One Health approach? I'd like Dr. Adnola to answer that.
Yes, so as individuals, I think our major role should be to ensure that while we're trying to protect our own health, we do not infringe on animal rights, and as well, we should not abuse our environment. Like we said, most diseases, what's responsible for it, it's largely human activities. So when people are not taking care of their environment, if they are, like for example, people they are stooling inside the river, doing things like that are not hygienic. These are things that can cause contamination in the environment that will eventually lead to passing of diseases between the environment and humans and all that. So I think the first step would be for people to be aware that all of the activities that would carry out impact our environment. So we need to watch what we do. We shouldn't be involved in indiscriminate bush burning, because things like this, it would affect the house for the animals, those wild animals that are living in those bushes. You displace them. And of course, when they don't have anywhere to stay, they come into the household. And from there, you're making contact with them and increasing chances of getting these diseases. So we need to ensure that we're careful with the activities we do so we don't negatively impact the environment. For those of us that keep pets, we need to ensure that we'll take care of these pets and ensure that they are vaccinated as recommended by the veterinarians. Then we should also take cognizance of the fact that we need to keep our environment clean. We should take our sanitation seriously. And whenever we're trying to do rodent control, we should ensure we're doing the rodent control that is environment friendly. We should not go ahead and use chemicals or things that would negatively impact the environment again. We need to find ways to do this so that we don't affect the environment. So first step is for individuals to take responsibility for their own health, for the health of the environment, and for the health of the animals that they interact with. Yes.
Okay, so Mrs. Amalara, just like you to also reiterate more on that, the roles of individuals in the One Health approach.
So just to piggyback on what she said, I think the key thing is to take responsibility. If we understand that our activities impact on these animals and environment, and they can, at the end of the day, affect our own health, then we would, be more conscious of the things that we do and take responsibility for actions. Let's not forget that we are all interdependent on one another. And while we have a voice and we can speak up for ourselves, the animals do not have someone speaking for them. The environment does not necessarily have speaking for them, except now that, everyone is coming to the realization of the fact that, yes, this interdependence does exist, and it's, beginning to affect us negatively. So in our little corner, how are we taking responsibility for the safety of our environment and even those of animals living around us?
Okay, so before I let you go, I'd just like you to also give what can government do, or what is government doing in championing the One Health approach, because most especially, like you just told me what a breakthrough action does and other organizations. Well, what can government do better to champion the One Health approach?
So the first thing that we're doing at government level is understanding that there's a need for us to begin to work together, to collaborate together, and coordinate our activities. And also, so it's largely around the 4 C's. We have coordination, we have collaboration, we have communication, and then we have capacity building. We understand that people have different expertise, and it's important to carry everyone along. So that's why the capacity building component comes in. Collaboration, like I said, when we all, come together and work together, we're able to achieve better results. And then coordination helps us to just know what every other person is doing and ensure that we're not duplicating efforts or, wasting efforts in other areas. And when we sit together at the table, we're able to communicate better and we have an understanding of what is expected of each person. So where one person's role ends is probably where another person's responsibility picks up from. So when we come together as one, we have an understanding of that and we're able to, come together to just ensure that things are happening in a coordinated manner.
Okay. So Dr. Adonal, I'd like you to give us your call to action for the government. What should the government do better in the One Health approach?
Yes, so I would say the government has been doing quite a lot because I'm aware that for One Health, NCDC has been, that's Nigerian Center for Disease Control. They've taken leadership on this and they've been able to coordinate the other MDAs, the Ministry of Agri, the Ministry of Environment. So I think the main step that needs to be done is at the state level. There needs to still be a lot of support given to the states so that the states can also replicate that level of coordination that has been achieved at national, because we know the way we can reach the grassroots would be really at the state level. So we need the state government to start taking ownership of this One Health approach and ensuring that that level of coordination that we currently have at national is replicated at the state level. Okay. So I think that's the major thing that needs to be focused on.
Yes. And I believe that's key because, we talk about the federal is almost like it's just up there, way there. Yes. And when we talk about states, that's where the communities are. That's where it affects the people the most. And more has to be done for yes. people in the grassroots to be aware of these things because honestly, we just move on doing our activities. We really don't care. We have people that keep dogs because they just want to have an animal that would eat their leftovers. Yeah. They don't necessarily care about this dog. Some don't necessarily care about these animals. Some just rear animals for eating and then forget that there's actually a health implication to whatever kind of disease the animal has, So it's very, very important that these things are taken to the grassroots so that most especially local farmers, and funny enough, the farmers are the ones that are in the grassroots, and most times they're the ones that don't have the information. And truth, they're the ones that need the information more than even the people up there, because they're the ones that do most of the production of the things that we eat. So it's good, just like you said, that this is taking to the grassroots so that people are more aware of it. I sincerely appreciate your presence on the program today. It was very nice having you to talk about One Health and zoonotic diseases. But before I let you go, just like you to give one word of advice each on zoonotic diseases in One Health and what we should do as individuals. I'll start with Dr. Nola.
Okay, so as an individual, I would like us to take responsibility for our actions. We should take responsibility. We should know that we need to protect our environment and the animals that we're interacting with on a daily basis. And we should ensure that whenever we have fever, we should always go to the hospital to be sure that of what we have. We should not go and start self-medicating. So taking responsibility is key. Thank you.
Okay, thank you. And Mrs. Amalara?
Okay, so I think I'll start with the theme for the One Health Day, which is when one is safe, all is safe. Let's protect animals, environment, and humans. When we understand that the safety of all depends on the safety of one, then we will begin to take responsibility for our actions.
Thank you very much for taking our time to be here with us on the program. We sincerely appreciate your presence.
Thank you for having us.
Thank you. Well, that's the size of the package today. Do remember that we all have to take responsibility because all animals' health and welfare affect us in one way or the other. So always take care of the animals around you and your environment. Do keep it a date with us same time next week. I remain your host, Lois Apasambo. Do stay safe.